And we are live. Okay, Sonia, off you go.
Great. Hello, everyone. Thank you all very much for joining us. Some of you again today. We love hosting events in Harvey Nash. This particular series of events, Nash Talks, was born from a conversation we all had when we all found ourselves in our new working world and at home for the first time. And we thought, how can we help and support the current situation we find ourselves in? The first one, we spoke about how to build a better immune system and nutrition. Last week, we were talking about our workstations and how we can protect our posture more. We had a physiotherapist guiding us. And this week, we are talking about mental health. So we are thrilled to have Christian join us today. Christian, thank you so much. Christian is the founder of My Mind. He founded it in 2006. It's an innovative vision to give mental health support way more accessible and affordable, enabled by technology. And when we talk about curves, and we're talking about curves a lot at the moment, he really is ahead of the curve with this one. So, I mean, we're reading so much at the moment about the peak in requirement for this service, from the obvious frontline workers to those of us losing our jobs or battling to save our jobs, to losing loved ones. So it's very, very timely. Christian, thank you so much for agreeing to share your story and tell us all about your service today. I'll hand over to you.
Great, thank you very much, Sonia, and thank you very much for this invitation. Hello, everyone. My name is Christian Fiekert, and I'm clinical psychologist. And today, I will try to cover some of the points. I will tell you a little bit about myself, then about mental health in numbers, and then a little bit about what we do, our vision, our work. And then we move to online counseling and suitability of online counseling, and then some of the IT systems to support therapists and clients. And at the end, there will be also a short discussion about managing mental health during the crisis that we are in at the moment, COVID-19 crisis. And we will have some questions and answers discussion at the end. So a little bit about myself. I'm a clinical psychologist by training. I'm also ex-Googler. I love programming. I love technology. So that's why I end up working for Google for a number of years. And then after Google, I moved to HSC to work as a psychologist. I had very, very good kind of insight experience from for-profit sector, tech sector, and then health service sector. And I realized that technology can really, really significantly help and improve access to mental health. So that's why with this innovative kind of solution that I created back in 2006, I was elected as a Ashoka Fellow, and Ashoka is a global organization for social entrepreneurs. And in Ireland, we have only 13 Ashoka Fellows. I'm originally from Poland, living in Ireland for the past 16 years. I love traveling. I love exploring new cultures, new countries. Still have long list on my map of the countries to visit. So just to give you some idea of mental health numbers. WHO, World Health Organization, is stating that 25% of the world population would suffer from mental health difficulties at some stage in their life. This number is actually significantly larger. And there is various different numbers in various different reports. But on average, we think that it's around 10% of the population that are actively seeking for mental health support. That includes counseling service or psychological support every single year. So that's quite large number. As I said, there is a lot of different reports, and some of the reports stating that in EU, this number can be as high as 32%. And in some other reports, more kind of financially focused reports, we can see that every year EU is losing around 4% of the GDP related to mental health difficulties. So that's quite high. very high, and there is still no data related to the COVID-19 crisis, but we already see that this number, especially 10% every year, would be at least doubled, and there will be a lot of people post COVID-19 seeking for mental health support related to various mental health difficulties related to isolation, depression, or stress, anxiety issues. So when I set up the organization back in 2006, my idea was really to pioneer and create new sustainable model of community-based services that are delivering online and face-to-face counseling services, and that are accessible and affordable for to everyone, really. And at this particular stage, we provide over 40,000 appointments every year, and this number is definitely increasing every year by 20–30%. We currently have over 120 mental health professionals working with us, providing services in 15 different languages. Oops. So I mentioned about 10% of the population that actively seek for mental health services every year. And this number can be quite scary, because even when we think about Irish context, that's over 400,000 people every year. And now the public health sector has some limitations and mainly focusing on people in crisis or presenting very severe mental health difficulties. And so they provide approximately the services to approximately 70,000 population every year. And private sector is very hard to estimate, but there is various data stating that could be around 50 to 60,000 people accessing private sector. So when we look at this 10%, still 70% of the population has no particular access. So that's huge number and huge scope to cover. So our focus is very simple. We're providing low-cost counseling for everyone in Ireland. We currently providing this through the physical locations. So we have 5 physical locations: 3 in Dublin, Dublin 1, Dublin 6, and Dublin 8, Cork and Limerick. And then we have number of MyMind members across the country. In terms of the clients, we provide services to all ages. There is no particular limit, and to all really all backgrounds. Of course, at the moment, because of the COVID-19 crisis, we had to transition very smoothly only to online services. So all our services currently we provide online, so that's video and phone. Normally, we would provide the service for to clients 18 plus, but because of the current situations, we lowered the requirement in terms of the consent form to clients from 16 years old. And we're providing parental support if there is any particular difficulty with younger clients. We have very strong quality control and base for the research, because we collect quite a lot of data. And I'm going to tell you a little bit about this in a second. So in terms of the video counseling that is currently provided by many private providers and many other organizations, there is a lot of questions about how effective is video counseling or how effective is phone counseling. So in general, if the relationship is already established, there is no really difference. And that's because if the initial appointment, and that's the advantage of our service, blended service, where the client can actually access first appointment face-to-face and then continue online, the relationship is already established. It's very, very easy to continue this engagement via video calls or phone calls. If there is no previous face-to-face engagement, there is no strong data, to be honest, referring to the effectiveness. There is some of the research stating that video counseling can be more effective because there is more visual component, but on the other hand, phone counseling can be more effective if there is no privacy for the client. And both video counseling and phone counseling are unfortunately limited by the therapy approach. So not all the therapy approaches suitable for counseling. So I'm going to talk about this a little bit later, but the main kind of leading approach is CBT approach that works very well for most of the video counseling sessions. And recently there was a lot of research supporting other approaches, even including EMDR approach that is used that is mainly used for the post-traumatic stress disorder. But still, CBT would be the leading approach for counseling and psychotherapy delivered online. There is definitely a stronger preference for video counseling among younger population, and that's for sure. There is a number of challenges that we currently see even through the COVID-19 crisis that is related mainly to the access to technology, network coverage, and that can be on both sides of the client and therapist. So even though if the technology is already built and out there, might be issue with let's say internet connection, or someone can have a very low upload speed that might be difficult for video streaming. The other kind of main issue that is currently among private providers is kind of limited knowledge of the difference between shared IPI and private IPI. And most of the current video streaming platforms, they're using shared IPI that is not very safe for all the healthcare related consultations, including mental health. So then the main kind of difference between the shared IPI and private IPI is really the cost. So for most shared IPI technology, there is free delivery, where the private IPI, for every single session, there is a cost that is roughly $1.20 per call, or $4 per phone call. In terms of the suitability, if the online service is suitable for all of us, or for all, the simple answer is no, and there is a lot of exclusion criteria. Of course, during the COVID-19 crisis, we had to ease some of the criteria. The main kind of issue, or the exclusion, is related to age, and that's mainly because of the parental confirmation that the child can use the service. So I mentioned at the beginning 18 years old. Now the minimum age dropped to 16 years old. The question is, how effective can be family therapy over the video call, where there might be a lot of frustration, a lot of discussion, and if the therapist can handle the whole family. So that's question to answer. Normally, we wouldn't suggest family therapy over the video calls, but during the COVID-19, that's possible. Also, couples therapy normally wouldn't be preferred to be delivered over online, but during this particular crisis is possible. Definitely, online counseling and psychotherapy is not suitable for clients presenting very high suicide ideation. So in this particular case, we would still refer clients to emergency service or a crisis service. And also the same situation would be for clients presenting any psychotic episode. So what will be the kind of main mental health issues that are popular for online video counseling sessions? Normally, that will be clients presenting anxiety issues, probably in most of the cases, social anxiety, in some cases, health-related anxiety, depression issues, stress issues, or isolation issues. Nowadays, we have some more variety of mental health issues presented by clients. And I mentioned that CBT would be the leading approach for video counseling and phone counseling. In terms of the IT support, it is very important to be transparent for the client with the clients. So that's unfortunately what is missing most of the time in terms of the private providers or single private counseling services, where there is no particular access to data. So clients, they won't have access to their own data, or the access might be limited. In terms of our service, that was the main goal since beginning, really, to provide full access to the data that we collect. So in our case, when the clients go to mymind.org and they click Get Started, they set up the profile. After when they set up the profile, book appointment, they have full access to all the data that we collect and they share with us. So that kind of gives a very good level of transparency, sense of collaboration, decision-making for the clients, and there is also a lot of feedback opportunities for the clients. And in terms of the therapists, proper system in place can also support the work of the therapists, especially in terms of the clinical procedures. So there is very good clinical support work and training that can be very beneficial for long-term work with clients. And definitely access to clinical outcomes and progress that, again, can be shared not only with the therapist, but also with the client. So if the client and therapist has full access to the outcomes of the therapy, then they can work much faster and much more efficiently through the therapy process. So that's kind of my last slide related to the impact of COVID-19. And we're still collecting information, collecting data. We're currently working with the HSE and Department of Health as well, just in relation to this particular issue. And we are definitely ahead of the curve in terms of the technology that we provide and the access to online services. A number of people that currently use our service for video counseling and phone counseling, but we definitely see huge increase in terms of particular issues among certain groups, like frontline workers, high stress, anxiety, PTSD related issues, in terms of the older people, certain level of isolation, anxiety issues, depression issues. Active workforce, even though there might be certain work at the moment, but anxiety related to how I'm efficient at work, for example. Am I efficient enough? Do I have proper working space? Am I able to deliver all the outcomes according to my schedule? And then we have new group, increasing group of unemployed clients, and they present definitely high level of anxiety and depression. And this, we will see definitely, again, higher number of clients post-COVID-19. So the simple recommendations that we kind of came up with our clinical team and mental health professionals, and we were asked a number of times what would we recommend, and this very, very simple: to stay connected with your support network. That could be the network of your work colleagues, or could be network of your friends, family members. Very importantly, create your healthy routine. When we work from home, most of the time we forget about routine, or the routine is gone. Yeah, so we need to create new healthy routine for us, and it will be extremely important and good to have a proper working space where there is psychological association that this desk is my desk and that's my working desk. It's not the desk where I can relax or watch a movie or sleep even, right? Because when we work from, let's say, bedroom, most of the time we can realize that we are not effective because bedroom is associated with relaxation and sleep. The other very simple recommendation is to exercise, ideally every day, and ideally for minimum 30 minutes. Eat healthy and regularly. Again, very easy to postpone some of the regular food, or not even, or even skip some of the meals. It's very important to eat healthy and not too late, and then sleep regularly. So that's all our recommendations. I know that it took a little bit longer than I expected, but yeah, now we have time for questions and answers.
Brilliant. Thank you so much, Christian. One of the questions that has come up is some of us are sharing with flatmates that we may not be that close to, or family members that we're very close to. What behaviors might indicate that someone is struggling? Are there signs that we should look for?
Well, definitely, if there is a certain sign of isolation, yeah, or avoidance. So if the person is not talking anymore, or avoiding any particular contact, that might be a very strong indication that something is happening. Yeah. So if this person is not willing to talk to us face to face, maybe somehow we can try to make a contact, even via social media, or via the regular communication platform that we use. Could be WhatsApp, or even text message, or even simple note, to leave simple note in the common area like kitchen or living room if this person is coming. Simple note saying, if you want to talk to me, I'm there, I'm available for you. Yeah, because sometimes people just need this small notch. Yeah, the support is there, support is available.
Okay, thank you. And if I'm accessing a service, which a lot of people are for the very first time, what can I expect? What does it feel like to receive counselling online?
Yeah, well, we have very, very standardized process. Normally, first appointment is more or less kind of small interview, yeah, between the client and counselor, because counselor needs to gather some more information where the person is, what is happening. So it might be a little bit feeling like, oh, I'm kind of in the interview process, which is normal because that's part of the clinical interview. And we have set of questions. Normally, we ask all of these questions during the registration process. So if you are, let's say, if you are our client and you go through the get started process, there is a number of questions. And if you answer these questions, that would cut a lot of the questions that normally counselor would ask you. And then normally at the first session is to establish the goal. So what is happening, where on what goal do you want to work. Yeah, and if there is a, let's say, anxiety issue, we will work on the anxiety issue. So then the first session is really to gather information and to get a sense where the mental health problem is.
Okay. I know we as a business, even at board level, have begun to talk about the need to be open about this topic and to allow people to talk about where they might be struggling. If there's people on this call who are business leaders who want to take that a step further and provide support to people more formally, how can they do that through your platform?
Yeah, so we actually work with a lot of businesses and small, medium-sized organizations, or even larger organizations. So we have a program called My Mind at Work. So you can easily request or purchase a package of appointments. So let's say 20 counseling sessions, and you receive one code from us that will contain this 20 counseling sessions. So then your employees can easily redeem these sessions in our system and avail from free counseling if that's what you would like to provide to your employees. So it's very, very simple process.
Mm-hmm.
And we can definitely arrange that. And also we provide talks and workshops. So at the moment, of course, we have online version of the talk and workshop related to mental health well-being in the workplace.
Okay, I loved your price point just in terms of making the service accessible to all. Can you just tell people a little bit about how that works?
Yes, because we are social enterprise, so we really, our main focus is to be sustainable in the sense as an organization, as a business, but really focus on social mission. So we provide three kind of level of fees, and the lowest fee is 20 euros that we mainly offer to unemployed clients, full-time students, or retired clients. And then we have 30 euros for part-time employees, and our standard fee is usually 50 euros for single one-to-one session. So normally this particular fee supports the other fees. So it's very, very simple model.
Okay. I know everybody is different, but have you a view on how many sessions it would take for somebody who's just experiencing something like anxiety for the very first time in this crisis? How many touch points? What, how long would it take to give them the tools to sort of feel better?
So normally, I would say, and that's what we saw in our data collected over the number of years, that normally is around seven appointments per person. So that would be the average.
Mm-hmm.
Of course, in the current situation, we're still gathering information, and we need to see if this will be changed, if that will be, let's say, longer approach or maybe shorter. Yeah, but we still have too little data to make any statement. But definitely, looking at the previous years, that was on average 7 appointments per client.
Okay, I think we have time for just one final question. As culturally, we had begun to talk much more openly about mental health, which was just a real positive change. Obviously, this has accelerated the conversation. Do you have a view on the future of mental health and how it will be transformed coming out of this crisis?
Yeah, well, definitely. Our society is more open, which is great. Yeah, there was a huge shift. Even I remember when I moved to Ireland back in 2004. There was conversation about mental disease, almost very negative connotation. And in the recent years, we changed this wording to mental well-being, which is very positive. Yeah. Mm-hmm. So there is this very positive change in the nation, which is great because more and more people think about mental health as something that we have. It's part of us. Mm-hmm. Yeah, there's nothing wrong to have difficulty to feel stressed or to feel anxious. Yeah, and that's part of our life. And in certain moments, we just need to ask for help, or even the help can come from the support network. It doesn't need to be the counselor, right? If we have the right support network, and if we are not afraid to ask for help, the help is there.
Yeah. Much more positive that the stigma has been taken away. Thank you very much. That was really insightful, and I genuinely hope that your people understand that there's a service like this out there that's just so easy to access, technology enabled. Press of a button, you're talking to somebody. We'll certainly do all we can to get the message out there to our own audience, and we'll be sharing this video afterwards if people want to understand more. So just thank you very much for taking the time today, Christian, from Harvey Nash. We really appreciate it.
Thank you very much, Sonia. Thank you, everyone.
Thank you.
Take care. Bye-bye.